Did you know that 1 in 4 New Zealanders will face fertility challenges? This time can be lonely, isolating, confusing, and traumatic. Kia ora koutou. I'm Lydia Hemingway and I am the CEO of Fertility New Zealand. Thank you for joining us tonight and welcome to the Fertility New Zealand webinar series. Fertility New Zealand walks alongside all people facing fertility challenges. We do this by providing support and information services and being the voice of this community through our advocacy work. I encourage you to jump onto our website and check out our services and connect with us on social media. Tonight, I'm so pleased to introduce you to Dr. Lucy Prentice, who is our wonderful guest presenter. Lucy is going to talk to us about the fertility questions you should be asking your doctor. Lucy is an obstetrician, gynecologist and fertility specialist working at Fertility Plus in Auckland. Tonight, Lucy is going to cover topics such as when to seek help, how to get a referral to a fertility specialist, and what to expect from an appointment, and just so much more. This webinar is useful no matter where you're at on your journey, but it will be particularly relevant for those at the beginning of your time, trying to conceive and are unsure about next steps and when and how to see someone. At the end, we'll have time for questions. Pop them in the chat anytime, but we'll look at them towards the end after Lucy's finished her presentation. I really hope you enjoyed the webinar and get some value and some useful tips from it. Over to you, Lucy.
Thanks very much, and kia ora everyone. I'm Lucy, and happy to be here to talk to you all tonight. So I'm just going to talk through some slides, and then at the end, if anyone's got any questions, more than happy to answer them. So this is just a bit of an overview of what I'm planning to cover tonight. So when to seek help, how to get a referral, both through the public system and if you wanted to pay privately for a review appointment, what you might expect in an appointment with a fertility team, and then explaining a little bit about how the publicly funded fertility service works in New Zealand, and then at the end, time for questions. Just a brief broad overview of fertility. So infertility medically is defined as being unable to conceive after 12 months of regular unprotected intercourse, and affects around 15% of couples, so between 1 in 4 to 1 in 6, depending on how you define it. And in general, we recommend that you seek further help after 12 months of trying to conceive. There are a few exceptions to that. So for women, if you're over 35 years, we tend to encourage you to get some testing done if you haven't conceived after 6 months. Or if you have a condition that may be associated with severe fertility issues, and those might be things like very advanced or severe endometriosis, known severe male factor, so if you have no sperm in the ejaculate or very few sperm, if you have absent or very infrequent periods, so we're talking 2 or 3 periods a year, or if you've got known tubal disease. So that means your tubes, you know that your tubes are blocked or damaged. And then just remembering that there are other reasons why people might access the fertility services, and that is for things like being in a same-sex relationship, single persons, people that carry inheritable conditions, and women that might be interested in social egg freezing. We do onco-fertility, so medical fertility preservation, and then fertility preservation for transgender or non-binary people. So how to access help. So there's 2 ways you can do this. You can either self-refer, which would always be a privately funded appointment, or you can see your GP, who will refer you through the public system. There are some referral criteria that have to be met in order to be eligible for referral publicly, and those would include things like the female being under the age of 40, the male being under the age of 54, and there are also height and weight cut-offs, which vary slightly throughout New Zealand. And then there's, I've just listed here all the places that have clinics. So permanent clinics are ones that have an actual IVF laboratory associated with the clinic, and there are 3 in Auckland, and then there's 1 in Hamilton, Wellington, Christchurch, and Dunedin. But there's also satellite clinics in a lot of other cities in New Zealand. And I've listed them on the right of the screen. So that will mean usually that there's a visiting fertility specialist that comes and does a clinic in that centre. And if you were to seek fertility treatment, you would then move to the centre closest to you. So what we need for a public referral to a fertility clinic to be accepted after the GP has sent it is for confirmation that you've been trying to conceive for 12 months or you've been found to have severe fertility issues. We need an FSH within 12 months, which is a blood test. And it's a blood test that is really only useful if it's taken in the 2nd or 3rd day of the menstrual cycle. However, if you don't have regular cycles or you can't get to a lab at that particular time, actually just any FSH recorded on your blood results will be sufficient, and then the male partner needs to do a semen analysis. If you don't do those 3 things, the referral will not be accepted. And then I mentioned some of them before, but some points that would make you ineligible to be able to access an appointment publicly are the age and BMI cutoffs, and then if you have more than 2 children living at home, or if either of the couple are in jail. So in Auckland, all of our referrals go through a service called the Northern Regional Fertility Service, and they're assigned, you would be assigned to one of the 3 clinics in Auckland, who all hold public contracts as well as their private work. And then in other centres, you would be referred simply to the clinic that was closest to your domiciled address. So for private referrals, there's information for all of the clinics. So Fertility Associates is the clinic that you would go to outside of Auckland, because all of the clinics outside of Auckland are Fertility Associate clinics. And then if you are in Auckland, you've got the choice of all 3 clinics, and you can just call up and book an appointment. Wait times for private appointments vary clinic to clinic, but usually would be within a month, whereas wait times for first appointments publicly again vary across the country, but are around 4 to 5 months in Auckland. So what are some useful things that you could do prior to an appointment? So the first thing is making sure you're on prenatal vitamins. So folic acid is recommended for all women trying to conceive, and we also recommend iodine for people that have been having fertility difficulty who are trying to conceive. These can be prescribed through your GP, or you can get them over the counter as part of a multivitamin called Elevate. It's much cheaper to get it through your GP. And if you've had any previous fertility appointments, investigations or treatments performed either in New Zealand or overseas, it's very helpful if you could bring those with you. We don't share information between hospitals and between the private and public sector, and so if you have those available ahead of time, that's hugely beneficial. And then familiarizing yourself with something called pre-pregnancy carrier screening, which is a little outside the scope of tonight, but I'm happy to answer any further questions that people have on it, which is a test that you can pay privately for that screens you and your partner for genetic conditions that you can pass on to your offspring. And then a general health assessment with your GP, including a set of bloods that we recommend prior to pregnancy to check that for things like diabetes, rubella immunity, that you've got good iron stores, all of those important health parameters that we like to optimize before pregnancy. Ensure that you've got your cervical screening up to date, because all clinics in New Zealand require you to have up-to-date screening before you can have treatment. And then if you're having a cervical screen done at the same time, I'd encourage you to do STI swabs, which are swabs for sexually transmitted infections at the same time, because again, all clinics will require you to have up-to-date swabs within 12 months of starting treatment. I mentioned the pre-pregnancy screening before, which is what's included here. And before a private appointment, it's not a requirement to get a semen analysis done, but it certainly would be a useful thing to have and bring with you the results with you for the appointment. And then I've just linked here, so the Royal Australian and New Zealand College of Obstetricians and Gynecologists has a couple of really nice handouts on things that you can think about prior to pregnancy. They've also got a handy information sheet about genetic carrier screening to read. So during your first consultation, so if you can, and I know that it's not easy, but it's really helpful if you come as a couple. 25% of fertility delay is male factor infertility, and so the male partner is a hugely important part of the equation, and it's really beneficial if he can attend the appointment with you. If he can't, we totally get it, but it's always something that I think is super important if you can make it happen. And then what will we talk about? So the doctor will run through both of your medical histories, and we will ask some pretty personal questions as part of that consultation. Some of the ones that are fairly obvious: how long have you been trying to conceive? Your sexual history. So we do ask you a lot of questions about how often you're having sex. Are you timing it correctly in the cycle? Do you have any erectile or ejaculatory problems, or other issues that you're experiencing during having sex? And it's super important, as embarrassing as it may be, for you to be really honest with us, because it's obviously very useful information. We ask you about previous sexually transmitted infections. Again, super important that we know about that. If you don't feel comfortable disclosing something like this in front of your current partner, which some people find, you can always contact the clinic through reception at a later date to inform your doctor about things you didn't want to talk about at the appointment. And that includes past pregnancies, miscarriages and terminations as well. Some people find difficult to talk about. We ask you about any previous pregnancies that you've had, and then we ask you about your general medical and surgical history, and then medications, allergies, smoking, drugs and alcohol history. For the woman in particular, we're quite interested obviously in your periods. And if you track them on an app, which heaps of people do these days, it's really helpful to bring that with you. And also to work out how you formulate, most of the apps now can give you an average cycle length and how long your period, how many days you bleed for, and that's really useful information for us as well. And for the woman as well, any past gynecological history of note or previous surgeries. And then for the man, we do ask you a lot about your testicles. So have you had any trauma or surgery on your genitals in the past? Have you had a history of mumps or tuberculosis? Have you fathered any pregnancies? Have you fathered any children or had any previous pregnancies with other partners? Those are the questions that you might get asked. So examination, so not usually a routine part of a fertility consultation. Your height and weight might be taken. In some clinics, we might do a bedside transvaginal ultrasound scan if you consented to that. And sometimes a speculum or bimanual, which is an internal exam, may be recommended based on history. But again, these are things you can opt in or out of. And for males, if you seem to have severe male factor issues based on your semen analysis, then we will recommend an examination. And that would be to look at things like the size of the testicles, feel for any masses, and we feel for a special tube at the back of the testicle, which is called the vas deferens, and look for things called varicoceles, which are like blood vessel disorders of the testicle, and we measure the testicle size with a special little sort of beaded necklace that you might see in some of the clinics. Investigations will depend really on your history, and I don't think there's much point in going into these in a lot of detail, but often we will recommend additional blood tests, an ultrasound scan, tubal patency testing. Semen analyses may need to be repeated at our laboratory, particularly if there have been any abnormalities picked up on community laboratory testing. We would offer genetic carrier screening again, and usually in most clinics, I can't speak for the other ones, but at Fertility Plus, we would bring you back for a review appointment once all of your tests had been done. Clinics aren't funded by the government to offer review appointments. However, we do offer a funded review appointment at Fertility Plus because we think it's important to talk you through the results and discuss options. But it will only be one publicly funded review appointment, and then we would score you for whether you were publicly eligible for fertility treatment, and any further appointments or things, if you weren't eligible, would be privately funded. So the outcome of the appointment, particularly if it's a review appointment, is to work out what the next best steps are for you, and what treatment options we might offer or recommend, and then we work out if you're eligible for public treatment. And really the four main fertility treatment options that are available are to continue to try naturally, and that's a very important one not to forget. Ovulation induction, where we give medications to help ovulation to occur, intrauterine insemination, and IVF. And again, a little bit outside of the scope of the talk today, but it's just a useful idea about some of the things that might be talked about at a follow-up appointment. So how does eligibility for public funding work in New Zealand? And I think this is really an important thing to understand at the beginning of your fertility journey, and to just have an awareness of before you come to clinic. Unfortunately, we are working within a system that is not given a lot of money from the government and has pretty harsh criteria for eligibility. And so there are some strict yes or no criteria. If you don't fall into them, you don't become eligible. And so you have to be a New Zealand resident or citizen, or have quite a long time remaining on a work visa. Your BMI has to be under a threshold. Your age has to be under a threshold. You have to be a non-smoker, and this includes vaping, and you can't be using any illicit drugs. And then we use something called a CPAC score, and it's just a means of trying to fairly allocate government funds. And it reflects an assessment of the likelihood of you being able to conceive spontaneously. It's not a perfect system by any means, but it's what we're working with a limited health budget. And the score considers things like how long you've been trying for, what the causes of the fertility delay are, how many children you have living with you already, whether either of you has previously had a sterilization, so that's like a vasectomy or a tubal tie. It does not take into account your ovarian reserve, which is usually tested through something called an AMH blood test, so that doesn't come into the scoring. And unfortunately, with how the scoring system works, some couples will not ever be eligible for publicly funded fertility treatment. So what then happens? So once you are confirmed as being eligible, you're placed on a wait list for treatment. You're usually entitled to 2 packages of care publicly funded, but only if the eligibility criteria are then met again after your first package of care is complete. And a package is either 4 cycles of intrauterine insemination or 1 cycle of IVF, which includes the transfer of all of the embryos. Unfortunately, once you're then eligible for treatment, if you want to have IVF, which is usually the most commonly requested of the 2 treatment packages, the wait time once you become eligible is quite long and is variable from clinic to clinic, but usually sits between 12 and 18 months. You can pursue private treatment whilst on the public wait list, but you can't have public treatment if you have frozen embryos in storage from a private IVF cycle. Great, and so I think that wraps up the actual presentation part. So I'm very happy to take any questions if there are any, which I think there might be. So anything that males should do look at prior to appointment. So thanks, that's a good question. So absolutely, I think it's important for both males and females to take the opportunity just to look at their general health, make sure that you're exercising regularly, that you've got a good diet, and then things that we know are particularly not great for sperm health are marijuana, high alcohol intake, and high caffeine intake. So if you drink a lot of coffee, trying to cut that down to 1 to 2 cups a day. And those would be the main things for the man. There are sort of like prenatal male vitamins that you can go on called Menavit, which is in general like a male antioxidant, which has been shown in studies to improve sperm health. That would be the other thing that you could consider doing. It's not particularly cheap, and you need to be on it for about 3 months before you'll start noticing any difference in sperm health. So it tends to be something that you should be on longer term. And Menavit, like Elevit, is not a prescription medication, so you can just pick it up at your local pharmacy. And does CPAC score take into account age, noting declining egg quality over time? So in my opinion, frustratingly, no, it doesn't. So there's obviously the age cutoff over which you no longer qualify for public treatment. But if you are under that age, so under 40 for a female and under 54 for a male, your age doesn't come into how they score you for funded fertility treatment. So a 24-year-old would be scored the same as a 39-year-old, and the wait time as well for treatment is the same, unfortunately, regardless of age as well. And then there's a question about, will we have access to medical records? So the records that we have access to will be the ones linked to your hospital, like your local, well, actually, at Fertility Plus, we have that. So if you come to Fertility Plus, we can see all of your hospital records if you've been in hospital across Tamaki Makaurau. so any of the 3 hospitals there, and we can see any blood tests that you've had done and prescriptions that you've had filled. However, I think some of the private clinics don't have access even to your hospital reports, so it really is helpful if you have significant history to try and bring those with you to the clinic. Yeah. Okay. Do medical gynecological conditions like uterine polyps or adenomyosis affect fertility? So they can. Having a polyp or adenomyosis does not mean that you will have infertility, but both of them are more common in the infertility group. So if you had an endometrial polyp, usually we would recommend that that's removed. Adenomyosis is a little bit more tricky, and your fertility specialist would talk to you a little bit more about that during the consultation. The presence of either of those does not mean that you can't have treatment or treatment won't be successful, but they can be associated with fertility delay. Do fibroids affect embryo implanting? So that question is very fibroid specific, and so would be a good question to ask your doctor if you had a scan that showed that you had fibroids. The vast majority of fibroids won't affect how an embryo implants, but some, particularly ones that indent on the uterine cavity, can do. And so bringing your scan report with you to the appointment would be very helpful. If you turn 40 while on the wait list, does this mean you are then eligible? Great question. So as long as you go on the wait list before the age of 40, it doesn't matter if you turn 40 whilst you're waiting for your IVF treatment. So for example, we're in February now. If I was to place you on the wait list for IVF today, and your birthday was on the 25th of February and you were turning 40, then you would still be eligible for that cycle of IVF, even though that might be a year away. However, once that first package of treatment was finished, you then would not be eligible for your second publicly funded package, because we would rescore you at that point and you would be over the age cutoff. Yeah. Would you consider helping anyone with a physical disability? Absolutely. We don't have any restrictions on the couples that we help through clinics. The only restrictions that we deal with publicly are the ones that are imposed through the CPAC score. And there is a small number of cycles every year that can be done with what's called a clinical override. So if you were just outside of one of those windows and we felt that you had extenuating circumstances, then that does get taken into account occasionally. But certainly we deal with people with physical disabilities all the time. Yeah. So I think that might be all the questions. Oh, here we go. Which is recommended if you're over 40 years old, fresh embryo transfer or frozen transfer? So that's a question that's probably best directed towards the fertility team that are looking after you once you get to that point. Neither is both fresh and frozen transfers are fine for people of all ages. that there's varying reasons why you might be recommended to have a fresh or a frozen transfer. And that has a lot to do with your cycle and your history, and would be discussed with the doctor that was looking after your cycle. I haven't talked to my GP yet. Can you repeat what I should be tracking now before I start this process? So just to get the question correct, I think what you might be asking is if you haven't yet seen your GP, but you have had a delay in falling pregnant and haven't started any of the process off. So in that situation, a great thing to do would be to track your cycles so that you know how many days you have between your period. So day 1 is the first day of your period, and then we count until the day 1 of the next period. So your cycle length includes your period in it. And so the textbooks will say that women have a 28-day cycle, and that obviously varies woman to woman. But having an idea about how long your cycle is, how many days, whether it's regular, is really useful. And going to see your GP for some pre-pregnancy checks is also important. So blood tests and cervical screening are the main ones. If you have been trying for more than 12 months, I would encourage you to go and see your GP and get some even basic testing done, even if you didn't want to then refer on to a fertility doctor. Because, for example, if you've been trying for 12 months and then the semen analysis shows that there's very few sperm in the ejaculate, then that's really useful information to know earlier on. And similarly, if you're over the age of 35 as a female and you've been trying for 6 months or so, doing those base tests is really useful, even if you then don't decide to take the next step and get referred through to the fertility clinic. And then always remembering to be on folic acid and iodine when you're trying to conceive.
Yeah, Lucy, I'm jumping back in now. Thank you so much. That's a really useful and informative webinar for the beginning of the year as well, when people often seem to make plans and start new things or reflect on things. I just want to check if there were any final questions that have come through. I can actually see one that's just popped up here. Would a delayed ejaculation cause any issues while trying to get pregnant?
So it can do. Obviously, if you're not able to ejaculate during intercourse, then that can definitely have issues with trying to conceive. But if there are issues with erection or ejaculation issues, then definitely see your GP, because they're a great person to be the primary reviewer of that situation, and then they can include that in a referral to fertility services if it's warranted. Yeah.
Thanks, Lucy. I think that's all of the ones that I can see there as well. Thank you so much. It was just great to hear from you and have you along this evening. Such valuable information and insight for us all tonight. Yeah, thank you so much.
You're welcome.
And to everybody else, make sure to follow us and keep up to date on our webinar series. Our next one later in March is with Helen Nicholson, a counsellor with ReproMed, who is going to be talking about the e-cart application process. A big thank you again, Lucy, for your time tonight, and also thank you to our webinar sponsor, Merck, who support us in the webinar series. So I just want to say thank you for attending, everybody, tonight. Our past webinars are all on our website and available, a huge range of topics. So please feel free to check them out, nice and easy from home, whenever you have a moment on a variety of topics. But good night, everybody. Thank you.
Bye. Thank you.